You are now listening to the Mental Health Check-In Podcast.
Good morning, good afternoon, good evening, and good night to everyone listening at whatever time you're listening. I am Jam, and this is a Mental Health Check-In Podcast, a podcast dedicated to spreading mental health awareness as a means to help us all heal. Healing for you, myself, my guests, my listeners, everyone. Everyone gets to heal. Let's start healing together. And today I hope we can heal using my conversation with Mikki Malkovitch, who does a lot of things. She's a makeup artist, photographer, model, blogger, creative director, a nurse, a podcaster as Nurse Ebony on the RNN podcast, Refreshments Narcotics. She does a lot of things, so naturally we talked about a lot of things in a conversation that I'm really happy with. I really enjoy talking to her, and I hope you enjoy as well. So I'm just going to transition to that really quickly in just a sec. But first, just as a reminder, if you like our conversation and would like to see more of my guests, you can see all of her work at either at Hey It's Mickey on Instagram or her blogging website at abomblesspit.com. And you can hear her podcast, Refreshments Narcotics, on all the podcasting platforms, Spotify, Apple Podcasts, Google Podcasts, practically, literally everywhere you can get your podcast from, you can hear it. So I definitely recommend checking it out, especially if you're particularly interested in just learning some insight into the nursing world and just seeing the world in general from the perspective of a nurse, or I should say nurses. Her and Nurse Ivory just do a fantastic job. Highly recommend it. I enjoy it very much, and I think you would too. And if you're a new listener listening to this podcast and you're looking for more of this podcast, we're also available on all podcasting platforms: Google Podcasts, Apple Podcasts, Spotify, everywhere podcasts are available, in addition to YouTube. So you can subscribe and follow just to keep up with new episodes, which air every Thursday. And you can check for updates either on Twitter at CheckinPod or on Instagram at CheckinPodcast, or you can just straight up email us at mentalhealthcheckinpod@gmail.com if you got a specific unanswered question in mind. Now, with that said, let's get straight to it. Welcome back to the Mental Health Check-In Podcast. My next guest is a lot of things. She's a registered nurse. She's a blogger, photographer, model, creative director, makeup artist, and a podcaster as Nurse Ebony on the Refreshments and Narcotics podcast. I tried to remember what RNN
Yes,
stood for a second.
wow.
But yeah, she is Mikki Malkovitch. How you doing, Mikki?
I'm doing good. How are you?
I'm doing good. How's your mental health lately?
I feel like it's been better in the past, but it is definitely not anywhere near the worst I've ever been. That's for sure. I think we're all suffering a little bit with this pandemic, extra stressors that we're not typically used to. Luckily, I've been very proactive about my mental health for a few years now. So I had some of those fail safes of, having a therapist, having being on antidepressants already. So in a way, I think that for those of us who were already seeking treatment, I feel like we were kind of set up a little better than those who may have been teetering on the edge of depression or just have gone untreated for so long and then kind of hit this disaster of a world that we're living in now in 2020 with no resources and no idea where to even begin looking for help.
Yeah, it's been a very difficult year for a lot of people, and particularly for you, just by being a nurse on the front line. So, first, I just gotta ask, I feel like I've already asked this a few different ways, but how you hanging in there? I'm sure things have been difficult, but how are you dealing with all the frontline stress?
So the burnout is real. Actually, burnout is a big issue in the nursing profession anyway. Even before pandemic, I want to say close to 70 or 80% of nurses are already working burned out. And then you throw this on top of it. It was a really rough spring and summer. Things are better today than they were back in, March, April, May. But the kind of trauma of going through the worst of it, I work in, a large hospital in Detroit. So we were hit really hard. Our entire hospital was full of COVID. A lot of us were just rock bottom mentally, watching people die all day, literally just watching them, push bodies down the hallway covered up, but like you could tell what they were. And that lasted for months. And then it slowly started to get better through like June, July. But now that the winter's coming back, we're seeing an increase in cases. And while it's not anywhere near as bad as it was before, that anxiety and kind of PTSD response to, oh shit, like here we go, hoping to God that we don't go through something that we went through before. Because I was coming home sobbing every day for a long time. And, so going through something like that and then having to isolate yourself on top of it from other people, maybe who, weren't in the medical field. It was a tough time, but like I said, I had resources at my disposal. Luckily, I feel very privileged to have decent health insurance and established care with mental health professionals. And I got to keep my job, which so many of my friends, ended up unemployed or were, really suffering financially from all this. So I as hard as it was to do what we did and to be there every day in the face of it, there's a lot that I'm thankful for from the experience, because I know that not everyone was as lucky as I was. We lost a nurse where I work. She died of COVID, and that was really hard. And I think a few other employees ended up hospitalized and, in critical condition for a month or more. And so that was our first time ever really having to fear for our own health while taking care of other people. There's communicable diseases everywhere, the flu. On a rare occasion, you may have a TB patient or, something like that. I think we had like a measles outbreak in our area a couple years ago as well, but like nothing ever compared to this, where every single room you go to, you're afraid, am I going to get something? Am I going to bring something home that might potentially hurt a loved one? What are the risks, especially in the beginning before we even knew as much as we know now about it?
I'm really sorry you had to go through that. Like, I knew it was tough, but I had no idea. I'm obviously never going to relate to what you've gone through on a personal level like that. So I just send my condolences for your friend and like everything you've experienced. I'm so sorry. That's all I can really say.
I appreciate that. And, I feel like we're all suffering through this together. It's a weird feeling that like when people refer to us as, healthcare heroes or like as being a hero, because like none of us feel that way. We were just doing our job and what we were trained to do, and what we took an oath to help people. So it wasn't a hard decision to show up to work every day. That is just what we do. And we all know, those of us on the front lines, we were very appreciative of everyone doing their own way, their part to make it easier on us by staying home and quarantine and kind of following the rules. And a lot of people suffered doing that, and their own mental health suffered from being isolated at home. And so, we're all in this together.
Absolutely. I feel like that type of worldwide, what's the word? Unite, I guess,
Mm-hmm.
for lack of a better word, like that's the best way that you could deal with these tough times. Not even just in the more direct definition of slowing down the COVID rates, but just helping each other help each other, like with each other's mental health, because we're all struggling in different ways, and it's not going to get any easier if we're divided mentally or physically in any way. But if we stand together in these trying times and try to help each other however we can, it makes going through these tough days a little easier.
Right. It's true. And it makes it hard being an election year to maintain that unity, because now that numbers, are things aren't as bad as they were in, earlier in the year, people are quickly forgetting how shitty it was and how hard it was. And so then it's just like right back to the same old divisiveness and hate. And it's like, it's really disappointing.
Yeah, it's really disappointing, and maybe it's just my optimism getting the best of me, but I can only hope that things get better in a way that people actually look at the numbers and realize what needs to be done to slow down numbers. Just social distance, wear face masks. It shouldn't be that hard, but for whatever reason, there's there's a dip in people doing that, and that's why we've seen cases increase, unfortunately. So
Well, it's just science has been politicized. So, they can deny the efficacy, but then, the consequences come either way.
yeah, and it shouldn't be a political statement. It's just it's basic health guidelines. If you want to be healthy, if you want to help the people around you and help yourself, you just follow these guidelines. But
Right.
for whatever
But
reason, people don't get it.
unfortunately, in America, I feel like a lot of people they don't care about anyone else but their own immediate circle of people. They don't think about that. It doesn't bother them that
Yeah,
thousands and thousands of people died. Like, it doesn't.
yeah. It seems like there's either a selfishness there or just a lack of awareness. Like a lot of people, I think, live in a sort of bubble. I think like they see things in the scope of themselves and people around them, but without the forthwith to understand things in a global setting, it's hard to really follow the guidelines in that type of context. I guess it's disappointing, like you said.
Mm-hmm.
But to tear from that a little bit, I'm curious to know just what do you do as far as like self-care practices to just maintain the betterment of your mental health. I know that you mentioned therapy and antidepressants, so I'm curious just as far as like general stuff. Like, can you talk about as far as the things that just make you happy that you do?
Obviously, I really enjoy art and photography, and so diving into creative projects has a huge impact on my mental health. Um, talking, talking it out, friends, family. Uh, I'm also in school, so like I just keep myself busy. To me, I never allow myself to slow down, and I don't know if that's a healthy coping mechanism or not, but I'm just always on the go, always doing something or like on to the next project. And um, I prefer it that way because I don't like to sit in silence with my own thoughts. And it's helped me get through the year. And, maybe I hope this pandemic can end and then I can maybe slow down and really process all of it. But for right now, I'm just trying to plow through the year and just accomplish as much as I can. Doing what I like and love and, getting my education and just Yeah, never slowing down.
I feel you. I'm kind of the same way. Like I would rather take on like a bunch of projects rather than just slowing down. Again, like you said, it may not be the healthiest thing, but in some regards, it feels better because I would rather be productive and know I'm doing something to better myself. And I don't really, with that type of drive, I don't really feel the stamina. I don't really get
Yeah.
tired too much. Does that make sense?
Yeah. Yeah. It's, yeah, I feel the same way. And people are like, well, how do you do everything? Because I do a lot.
Hmm.
But, some things that aren't as important to me maybe get neglected. Like my laundry pile is like really tall right now that I need to really do my laundry and I need to mow my yard. But instead, I would rather, like edit photos or, do something fun with my friends. So you hear my kitty cat,
Hmm.
Sully. This little kitty too. Oh, he's good for my mental health because he's so fluffy.
Let's talk about that a little bit because I always thought that was interesting. Like I've got really bad allergies, so I've never. Well, I've enjoyed other people's cats, but not without a little flare up here and there. So, so I'm curious, like, how does like having a pet, having a cat help you mentally? How does a cat help as like a confidant, kind of?
Well, I hate being alone. I've always been that way. I have two kids and I share custody with their father 50%. So half the time I'm alone, I live alone. And I really wanted a pet to like keep me company while they were gone. And so he does. He's so sweet, just someone to snuggle with, and he makes me laugh because he's silly.
That's adorable. What's the cat's name?
Sullivan.
Sullivan.
Mm-hmm.
Well, shout out to Sullivan. Sullivan's been a really cool dude doing this whole time. uh,
He's so silly.
Kind of staying on like the same type of subject as far as like getting out, like helping your own mental health as far as like managing stuff, like getting away from like the stress of like COVID and stuff. You, like you said, you do a lot of things, and I'm sure that comes with its own stress and anxieties, just trying to manage things on top of things on top of things. So, how do you reduce that stress the best way you can?
I try to stay organized. I have had to learn how to say no to some things and not take on every opportunity that comes my way because, you know, there comes a point where you're doing too much and then the quality of what you're doing in other, everywhere just kind of suffers for it. So, but always being a parent, being a mother is my top priority. Um, being a student, my education is the other priority, and obviously showing up to work and doing a good job is like the other priority. Everything else I can take as much as I can handle at any given moment, or I can put it aside if I need to, if I'm really busy in any particular moment. So I just think managing your priorities um, in a healthy way. Obviously, my kids will always come first, and just kind of going from there.
I think you made a really good point right there when you said that sometimes you have to say no to things. Like, I feel like as tough as it is to turn things down and say no, there's kind of a power in the word no. It's
Mm-hmm.
like it's easy to be in a kind of like mental funk if you're putting on too many things at the same time, but you kind of feel like a little bit of relief when you say no, because for one, it's difficult to say no, and two, it's you're subtracting things from that pile, and it's a good stress reducer, I think.
It is, and if you are particularly bad at setting boundaries, which I have been in the past, that was something I really had to work on. Practicing to say no it gets easier and easier each time. And you can do it in a nice way and explain, I'm sorry, I'm too busy, I have too much going on, or mentally I'm just not in it right now. I don't have the energy. People understand, you know. I have always had this fear of saying no to people because I didn't want to disappoint them, but um, really it gets easier as you practice.
Yeah, like, and that's something I've learned myself. Like, a lot of people, well, let me not say a lot of people, just generally speaking, me specifically, have been afraid to say no because you're afraid of being judged in some way or disappointing someone. But I've also learned that if you don't say no and then you get piles on top of piles on top of piles and you try and manage one thing, you're gonna mess up at one of those things. And then
Yeah,
you end up disappointing them anyway. So
right.
again, there
Exactly.
there's like a power in the word no. Like, you have to say no, not just for the betterment of yourself, but for the betterment of other people. And that's where boundaries come into play.
Right. It does. It can benefit everybody, you know. Because
So
how do
let,
they know that you are, like, if you just say yes, they don't know that you are overwhelmed or overworked or, um, maybe don't have the mental capacity to do a good job. So, like, they can't guess that out of you. You got to just say it. And 9 times out of 10, it would be fine. And then they can either find someone else or wait until you do have the energy. So,
absolutely. And if they're really a friend, if they're really on your side, they're going to understand when you say no. And
mhm.
if you just keep saying yes after yes after yes, there's eventually going to be a time when you have to say no. And because you've said yes so many times, you're eventually going to disappoint somebody. So it's better to just know in your gut, know in your head when to say no.
Mhm. And I think that the beauty of like growing older, for me anyway, I've just turned 31, is your friendships become way more emotionally healthy. You're at least for me, I've connected and attracted people in my life who are also very proactive in their own mental health. And that doesn't mean they feel great all the time, but when they aren't feeling so great, they can communicate that. And so in my group of friends, if, sorry, you know what, I can't make it to your party tonight because I just don't feel like myself. I just need a night off. And no one's going to be offended. Everyone's going to understand because we've all been there. So I think that comes with some maturity, some, uh, you know, a self improvement journey that not everyone has been through in their early 20s, like me. I was a nightmare back then. So,
That's a really good point right there. I never really thought about it in those terms. Like, the more you get older, the easier it becomes to become mentally proactive and have those honest, not even just conversations, but just statements. Like, for whatever reason, like, I think everybody has a different childhood or upbringing. So for whatever reason, everybody has a different reason why it's difficult to be honest with themselves, or not necessarily themselves, but with other people about saying no or just not going somewhere because you're not feeling yourself. When you get older, it's much easier to say that. And I'm not sure what that comes with. I'm just learning that myself. It comes with maybe wisdom, experience, I don't know, but it's
yeah,
with maturity
wisdom
comes
and
more.
experience, but also like when you are in a more healthy place, or at least when you are more self aware, I feel like you attract the energy of people who are in the same boat. Like you connect naturally with other people who are also on that journey of being the best versions of themselves that they can be. So
I think that's a great point. Yeah, it comes a lot of it has to do with self-awareness in a lot of ways, and you only get that self-awareness until you live and learn more about yourself. And like all things, that takes time and age.
time and maybe a couple mistakes and learning lessons from those. So.
Absolutely. To backtrack a little bit, like when we first started, you kind of said that you kind of you started taking steps toward your mental health a few years ago. And if you don't mind sharing, do you mind if I ask, how did your mental health journey begin?
Well, I was feeling suicidal for the first time at 15 years old. Um, I had this bad experience of like, my mom took me to this like small town family doctor who put me on this medication that was now that I'm a medical professional and looking back, was completely inappropriate to put a teenage girl who was depressed on this particular medication. This was a heavy duty, like antipsychotic, like very sedative, turned me into this complete zombie. And quickly my mother realized that this was not right. So she took me off of it. And then I just kind of suffered with my depression and anxiety for years after that. Um, and then when I turned, um, actually, after the birth of my daughter. I was 22, and about 10 months later, I became just severely depressed at that point, and couldn't get out of bed. I just was miserable, and my husband at the time basically drugged me to the doctor and was like, we got to do something because you can't live like this. And so they put me on an SSRI for the first time. And, I was scared. I had made myself suffer for years because I had that one bad experience at 15 of basically being like over medicated and, mistreated with medications. So I avoided seeking any mental health treatment after that because I was so scared of it. But this was like, it was the right medication. And it was like within 2 weeks, I was already feeling better. 6 weeks later, I'm like, great. And I couldn't believe that I had waited that long to be on, medication for this very long-term issue that I've had. And then a couple years ago, I got divorced. My son was about a year old, so I was dealing with some post-traumatic stress disorder from a very traumatic birth of my son, and also, a unhealthy, emotionally abusive relationship. And all of that kind of snowballed into another just deep but despite me being on a very low dose of Zoloft because I'd been pregnant all that time, so I took myself off of it during pregnancy. I didn't have to, I just did, and I wish I hadn't because I was depressed the whole time. And Zoloft is safe to take while you're pregnant, but um so I ended up going back to the doctor and being like, okay, this isn't working. And, I've also had severe nightmares for the last 9 years. Sleep disorder, waking up, sweaty, can't just wake up yelling, screaming, crying. It was so bad. I felt like I hadn't slept in years. And my doctor was like, it's no wonder you're depressed. You haven't slept. Like, we need to get you sleeping. So then she, started treating my nightmares and gave me something that would help me sleep. And then with that, I also started really diving into therapy. I had like a handful of sessions in the past that were, it wasn't like a long lasting thing. But this time I was going weekly for like 2 months, and then like bi-weekly for a couple months, and then once a month. And now I see her every 2 or 3 months. But I was really diving into changing my, you know, um, behaviors or my reactions to certain situations, developing healthier coping mechanisms, retraining my brain to have more positive inner dialogue. And all of that together just really brought me to like the best version of me I've ever been, along with getting divorced from the relationship that was a big trigger of my depression. So I feel great now. I am very thankful to have had the access to these things. I know that not everyone does, and that breaks my heart, um, which is why I will be voting on November 3rd. Hopefully, there can be some healthcare reform, because, you know, my friends now who are unemployed lost their health insurance, yet they don't qualify for Medicaid. You know, they're all depressed. They've been suffering through this pandemic. And when I say, oh, well, here, you know, go to the doctor. This is the doctor I use, blah, blah, blah. And they're like, well, I can't afford it because I don't have insurance. And it breaks my heart. It really does. Like, everyone deserves access to the same medical care that I've received to get to where I am today, because it's a night and day difference.
Absolutely. And first off, I co-sign that statement right there. And two, I'm very happy to hear that after going through all that, you can say that you're the best version of yourself today. And to just highlight for listeners, like it's very much worth going into therapy and medication to just work on yourself and become your best self. And this is something I talked with a previous guest of mine, Patches, who made a point to say, and I want to echo that sentiment, that it helps to always get first off a second opinion when you go on a medication or anything like that, and to understand there's trial and error. Like sometimes one medication may not work, you may need to try something else. Same goes with therapists as well. So
Yeah,
one therapist may
exactly.
not work, need to go to another one. So
I will, and you know me, I'm also in nurse practitioner school, so I've been diagnosing patients and treating patients and prescribing medications, and everyone's body is different. Everyone's body is going to respond differently. So when people seek medical advice from people who are not medical professionals, you know, they may get scared of, you know, like they may have heard my original story of, yeah, I, you know, got depressed. I went in, they turned me into a zombie and I'm never going back. And then they are too afraid to seek treatment, right? But there are so many options out there for medications and a combination of, you know, various medications that can be fine-tuned to work for you. So whatever your best friend or even your sister or your mother, like what works for them may not work for you. You may need something different. So you do have to have a little bit of patience and, you know, check in with your doctor frequently while you're starting these medications. And yeah, I would agree that therapists are also not a one size fits all. Um, I was lucky, the psychiatrist that I was seeing, she recommended the therapist that works in her, they have multiple therapists that work there, but she recommended this specific one for me because she felt like we would be a good fit, and we were. So it was, you know, I got lucky to form this really wonderful relationship with her right off the bat, not have to hunt around. But don't get discouraged if you do have to try one or two or three.
absolutely understand that it's a process basically. Like not all glows for all. It's you may need to go back a second or third time. It's trusting the process and understand that no matter who you get advice from or input from, understand that you have to just go with how you feel first and foremost.
Yeah, exactly.
And to piggyback off all of that, I was wondering to like tier to your blog a little bit, Bombless Pit, not
Mhm.
even just with your blog posts, but also just everything you've said today. Like you are very much an example of recovery. I think recovery from trauma in many ways, and your blog is the subtitle is a the aftermath of recovery. So to piggyback off everything we talked about, I was wondering like, do you have any advice for anyone wondering how do they recover from their own trauma in their own journey?
I would start with just being vulnerable and talking about it. Um, that is a big way I connected with people and healed, was just, you know, too often we feel the need to, especially in the age of social media, pretend to be perfect, pretend to have the perfect life, and, you know, not show the darker sides of what it is to be human. And when I, you know, I found myself a single mom, divorced, say at 28 years old. That was embarrassing for me. You know, I got married at 19. It's embarrassing for me to say that. I made this crazy decision as a child. But I found by just being, you know, hey, this is me and this is out there. And maybe by talking about it, it will help somebody else. And it's also therapeutic for me to get it out in the open, writing it down. And you know what? You don't even have to publish it. Just writing it down, journaling goes a long way. I'd say just grasp at any resource you can find. There are support groups out there. Um, you know, I would say don't lean too heavily on non professionals, you know, because sometimes our friends or our family can can get tired, and aren't going to be able to prop you up the way you need, especially through something really difficult. So while it is okay to talk to friends and family about things, I just think it's so important to have a professional in your corner that you can, you know, lean on in your most desperate times.
Absolutely, and I 100% agree there. And that might be a good place to end on, just have people chew on that. So, first off, I want to thank you again for coming on. But first, just one more thing. I have this recurring segment that I like to end every episode on. I call it giving people their flowers. So I show people, my guests, that they appreciate in case we never speak again. And first off, I'm always going to appreciate you just as a nurse, like COVID or no COVID. You guys have a tough job. And I know that you took an oath to do that. So it's not really like a heroic thing, but it's still a big deal, and a lot of people wouldn't take the same risk or couldn't take the same risk if you're immunocompromised like me. So I very much thank you for being on the front lines in there. I appreciate you as sort of this person who kind of unites the photography community together. Like these days, especially, like that type of sense of community is really important. So the fact you do that through your photo shoots and your meetups, it's really appreciated and like super dope, I think. And on a personal level, more personal level, I appreciate you for just last summer doing one of your meetups. I was gonna pop up as a photographer, but then you asked me personally to be a model so you can put the makeup and the paint on my face and stuff. And it's on the surface that should just be a really small gesture, shouldn't matter too much. But that mattered a lot to me just because 2019 was not an easy year for me. It was probably in many respects the worst year of my life, and that's taking into consideration everything that's happened in 2020.
Oh,
But yeah, but just smiling for that day, like that was a really fun experience, one of the highlights of my years. And I thank you for kind of giving me that day. And beyond that, I appreciate you as this strong, mentally strong, multi talented woman who I feel grateful to know. And I just really hope, more than hope, I really manifest nothing but success and happiness for your life and career. And I just think you deserve it and you deserve happiness. And I hope you have it. So
Yeah,
Hope you have that,
thank
and
you.
thank you
You
again.
make me cry. You're so sweet. Thank you. It means a lot.